All right. Well, welcome everyone. My name is Kelly Vita. If you don't know me, I am the owner and yoga instructor of Empowered Mama Fitness, a company that I created after giving birth to my daughter because there wasn't any pre or postnatal focused fitness or yoga in our area. There is my website and my handle on Instagram and Facebook if you want to follow me. But really, I just wanted to get into why I created this webinar. So I have a webinar series over the course of this year. We started with fertility in January, moving now into the look at the 3 trimesters now, really to empower women to know what's going on within their body as they go through pregnancy. I know as I was pregnant with my daughter, a lot of things were happening in my body and changes were occurring that I just didn't really understand or maybe didn't appreciate fully. And so I really want to bring all of the resources that I've studied, whether they be books or courses that I've taken, and compile them into one presentation. And the other thing is we do a lot of great things around the growth and development of a baby. So there's a lot of great apps out there. There's also a lot of great webinars or in-person events around birth and preparing for birth, but nothing really touching on like what's happening in each of the 3 trimesters. So that's where we'll go tonight. Of course, if you have any questions, please feel free to stop me and ask them. I will end with some meditation and movement. So hopefully you can stay till the end for that. Now, before we dive in, I really just wanted to talk about the miracle of birth. So, or really just creating life as a miracle. So I recently learned that in one ejaculation, there are 350 million sperm that are released. And so of those, less than 1 in 1,000 manage to pass through the cervix, and only about 200 actually make it to the correct fallopian tube. So we have 2 fallopian tubes, and 1 egg is released from each ovary every other month. And so the fact that of the 350 million, we get to the 200, and of those 200, only 1 makes it into the nucleus of the egg. Of course, there may be multiples, so maybe more than 1 may make it, but that is really cool that of that many, it's taken down to only 1. So I plan on telling my daughter one day that of the 350 million possibilities, I'm so glad that she's the one that I got. But after that, even after the sperm makes it to the egg, an egg is really only viable for 24 hours. So after it's released from the ovary, basically it is 24 hours of life to be inseminated. And if it's not, then it dies off and it comes out in a period. If it is inseminated, though, the 23 chromosomes from mom have to be a good match with the 23 chromosomes from dad. If they are a mismatch, chances are it will not be a viable pregnancy, and either it will be a miscarriage that you know about or one that you are unaware of because it just came out as a heavy period. Now, if the chromosomes are a good match, that fertilized egg needs to make it to your uterus, and your uterine lining needs to be thick enough with enough blood and nutrient dense or rich enough for the implantation so that the egg can implant. It can spread out kind of like roots of a tree, implant itself to form the placenta, and ultimately be the lifeblood for the baby. So the fact that we're here is amazing. I know growing up, high school, middle school, they made it sound like it was so easy to get pregnant. For mamas maybe who have struggled, just know that it really is such a small window every month that we have. And the fact that we get pregnant is really quite a miracle. Now, when we are pregnant, we go through a series of events over 40 weeks. So the trimesters are broken down, as you see here, into 3 trimesters. The first one is about 12 to 13 weeks. The second one's about 12 to 13 weeks, and the third one's about 12 to 13 weeks. Once we get to the 37-ish weeks, a baby is considered term. All of their organs have developed at that point, the lungs being the last, and those are done at 37 weeks. If the baby goes all the way to 40 weeks, they're considered full term, and anything before 37 is preterm. Now, it is common for babies to be born after 40 weeks, especially for first-time mamas. But really how far you're allowed to go depends on your provider, whether that be a doctor or a midwife, and the hospital or birth center that you're giving birth in. Only about 4% of women actually give birth on their due date naturally. So keep that in mind. If you are really shooting towards that one date on the calendar, chances are you will be after it if you're not induced before. Now, everything that we're going to talk about today is really around a healthy pregnancy. So maybe if you have undergone fertility assistance or treatments, you may have additional doctor's appointments and other types of blood tests or whatnot that may be taken, maybe additional ultrasounds, etc. So if this doesn't match you perfectly, this really is just like a general, common, healthy pregnancy. Now, in terms of the pregnancy itself, I know a lot of women will be a little self-conscious of the weight that they've gained. So I wanted to just touch on the fact that the weight that you gain during pregnancy is so much more than just fat stores. In fact, I put that at the end. So in a typical pregnancy, you'll gain about 25 to 35, maybe 40 pounds. A lot of that is extra blood. Your body is producing double the amount of blood. It's extra tissue fluid. The baby itself is going to be about 7 to 8.5 pounds. I've heard of babies that are even heavier than that. I'm sure we all have. And then the amniotic fluid, placenta, extra uterine lining, etc. So with all that said, when we give birth, a lot of the weight will quote unquote fall off, but a lot of it will take extra time to just decrease. The fluid won't necessarily be gone right away. The extra blood takes time to dissipate, etc. So be kind with yourself, not only on the weight that you're gaining during pregnancy, but also your recovery after. All right, so let's get into the first trimester. And so the first trimester is the first 12 to 13 weeks, as I said. And along the top, we see the key milestones. The fact, though, is that in weeks 1 to 2, maybe even 3, we're not pregnant yet. We haven't ovulated yet. We haven't been inseminated yet. The egg has not buried itself into our uterus. We just aren't pregnant, but the standard pregnancy is 280 days or 40 weeks, or 266 days from ovulation and insemination, but we don't always know that date. So we just go off of the date of our last period, and that's really where we get that 40-week number. Around weeks 5 or 6, though, we may start to experience some symptoms. We start to get an increase in blood volume over the next few weeks. And then within the 10 to 12 week mark, typically you'll have your first doctor's appointment with an ultrasound. And then around the end of the first trimester, a bump may start to appear. Now, the fetus itself, or the embryo, is so tiny to start, and it's really deep inside of your pelvis. So if you think about it, it's really not until it starts to raise above the pelvis that a bump is going to appear. So just something to keep in mind. If you have been pregnant before, though, your bump may appear a little bit earlier. I just know that a lot of us are really impatient or really want to see that bump as often or as quick as possible. And that's really towards the end of the first trimester. Now, we have a hormone that is created in pregnancy, and it's called HCG. And that stands for human chorionic gonadotropin. But I will just say HCG from now on because it's hard to say its full name. But that is what is going to alert you on a pregnancy test that you're pregnant. But it also creates nausea and frequent urination. So if you're experiencing that in your first few weeks, just know that it's the excess of that hormone HCG. We also have an excess in progesterone and estrogen, which causes some changes. The progesterone specifically is necessary for conception and pregnancy, but it slows down the contraction of smooth muscle. So where we start to see that in some of the changes in the first trimester is our digestive tract. So where it's contracting pretty strongly before pregnancy, moving waste along our digestive tract, it's now slowing down the contraction. So it's not necessarily squeezing as hard or as quick, and our waste doesn't move through the digestive tract as quickly. So you may experience some bloating or some constipation. Very common for both of those. You may have extreme fatigue. I know that's one thing that usually alerts me to the fact that I'm pregnant, I'm just tired, and I wake up tired. So that really is just the changes in our body and hormones and everything going into the work of creating a baby. Your breast may be sensitive, again, from those hormones. Shortness of breath, really, as we start to change our lung capacity. It may be harder to breathe in cardio situations or really just walking upstairs. And then very similar to our digestive tract, our esophagus doesn't contract as much as it used to. So some stomach acid may come up in the form, as acid reflux or heartburn. And then you may have noticed that you have an increased sense of smell, taste. Those may bring you to food cravings or food aversions, which may be a vicious cycle of more nausea. You have increased vaginal discharge, and then you might start to see some changing in pigmentation on your face, your nipples, freckles, areola, etc. All right. Now, in terms of the doctor's appointments that you can anticipate, as I mentioned, the first is maybe the 10 to 12 week mark, maybe even as early as 8 weeks. During that appointment, you may have your first ultrasound, which is very exciting. But I do write there transvaginal, and that is because that baby is so small. It's maybe the size of a blueberry or I forget what fruit exactly it is at that point. But remember, it's still down in your pelvis. So putting a ultrasound locator, sorry, I don't know the official name, but what you see in most movies, etc., where they're rubbing it on the mom's belly, with the ultrasound, that will not pick up that small baby as deep in the pelvis as it is. So what they do is they have a wand-like piece of equipment that they will insert into your vagina, and that is how they take your first ultrasound. Now, the first ultrasound is really going to be used to date the fetus. They're also going to look at some key development factors around what's happening with the fetus, but also around your ovaries, your placenta, etc. And all that will be used in subsequent doctor's appointments for you and your provider to discuss. Now, as we talk about dating the fetus, this probably is the most accurate dating method, as most all babies follow the same growth pattern in these early weeks. So after the first trimester, babies will go through growth spurts at different times. So the dating is inaccurate or not as accurate in later ultrasounds as it is in this first one. Now, this ultrasound will also tell you if there are more than one fetus, and it will find the heart rate. All of these things to understand if it's a viable pregnancy and to assess the health of the fetus or your growing baby. Now, if you are a little bit older, you may also be referred to a maternal fetal medicine specialist, or if you're considered a high risk pregnancy. So if you have pre-existing maternal medical conditions, such as cancer, diabetes, lupus, etc., they may send you to an additional doctor just to make sure that everything is going okay. They have a little bit more advanced technology in terms of ultrasound, so they can see if there are any issues with the baby. Doctor visits from here on out, pretty much until the third trimester will be about every 4 weeks or so. And they may make you provide a urine test at each one, really to check the protein and the sugar level in your blood. Now, there is a test that you can have done, but I say they're checked with insurance because it's not always covered with insurance, but it's called the cell-free DNA test. And so this will take a portion of the mother's blood, and they will use that to detect the baby's blood and provide from that an understanding if there's any trisomy 21, which is Down syndrome, 18, 13, or other abnormalities in the sex chromosomes, so that if there is an issue, they can have that conversation with mom and dad. It's really quite cool. Mom and baby don't share the same blood. We don't have the same blood type. And because of that, as long as there's only one baby in there, this cell-free DNA can determine between the mother and the baby's blood and pull from it any indications of abnormalities, but also can check the gender. So if you're looking to get the gender early, this is one way to do it. The other way, of course, is through an ultrasound, which is done much later in the second trimester. Now, if there are abnormalities, there may be a chorionic villus sampling that's offered. This is CVS for short, and it's a collection of placental cells at the insertion point or where the placenta meets the uterus. And so a long needle is used to take a sample of cells right between those two. And from those cells, they can detect any chromosomal or genetic disorders. The one thing is that this is a high-risk test, and 1 in 100 women will miscarry after this test. So a lot of people will say if the results wouldn't change your mind in terms of carrying this child to term or full term, then it's probably not worth the risk. There is also an Rh compatibility test that you might be given, and this is if you have a negative blood type and your partner has a positive blood type, your baby could potentially have a positive blood type, and your body would see it as a foreign object, foreign body, and potentially create antibodies for it. So we want to make sure that we do this compatibility test. It's quite simple to receive antibodies so that it doesn't impact the pregnancy at all, but it's just something that they may ask you about. And then you have blood tests for the items that you see there, making sure that your iron levels are appropriate, you don't have Hep B, C, HIV, syphilis, looking for the baseline of what your blood sugar is. And then it can also do some genetic testing, to see if you are a carrier for cystic fibrosis. They may also do a swab around the vagina and the anus for STDs, just to make sure that it won't be impacting your baby or your pregnancy. So those really are the key things that will happen in the first trimester in terms of key milestones, as well as different tests that you may receive. All right, now moving to the second trimester, we continue to see an increase in blood volume. During weeks 15 and 16, you may have an additional test called an amniocentesis. It's very similar to the CVS that we just talked about, but I'll go into that in just a little bit. Around weeks 18 to 19, you may have what's referred to as quickening, but really this is you feeling the baby's first movements. Now, if you have been pregnant before, this may occur a little bit earlier, and a lot of that has to do with what you're looking for, but your uterus is also slightly thinner than with your first pregnancy, so you may be able to feel it a little bit. Now, the feeling, at least for me, was like a popping, so a bubble popping or like a popcorn kernel popping. Some people think it feels like butterfly wings. You'll definitely be caught off guard, and you may think it's one thing, but it's most likely that quickening. The other cool thing that happens, maybe not around now, but now that you're aware of your baby's movements, you'll also feel hiccups, and it's the sweetest little thing. It's just the baby's hiccuping like we are inside of your uterus. Around 20 weeks, you have that mid-pregnancy scan. If you didn't do that cell-free DNA test, this might be where you do the understanding of the gender of the baby from this scan. And then around the end of the second trimester, you may have a cervical length scan to see if there is any risk of preterm labor. Now, by week 16, the top of the uterus is actually going to be between your pubic bone and your navel. By the end of this trimester, it will be about 2 inches above your navel. So you'll start to experience more of that growth. But as you'll see here from some of these common changes, you have a decrease in nausea. This really is that HCG that we talked about decreases 30% from what it was in the first trimester. So your nausea is going to go down. Your increase in blood is going to give you a healthy glow. So you have more blood, but it's also related to the dilation of blood vessels, which diverts more blood to the skin. So some people will say, Mama, you are glowing. And just know that it's because all of that blood is going to your skin. The next thing is stretch marks. So stretch marks is largely genetic, but it also has to do with how hydrated you are, both internally and externally. So for myself, I rub coconut lotion or coconut oil on my stomach and kind of give my stomach a massage after every shower. I also try to stay well hydrated and make sure that I have enough collagen so that my skin will stretch a little bit more. Stretch marks occur when you stretch quickly. And as your stomach grows, it could potentially stretch quickly. Some women don't experience stretch marks until the very end of their pregnancy when the baby drops, as that's when the majority of the stretching occurs in their lower abdomen region. But really, you can also see stretch marks around your hips, your thighs, your breasts, in addition to just your abdomen. So something to keep in mind there. Now, I put decrease and increase libido because there have been cases of each. So if you're like, yeah, I'm like really ready to go, maybe I'm more sexualized than normal. This may just because you're feeling sexy, your breasts are larger, your hair is luscious because it's really thick, your skin is glowing, etc. Others, though, may just feel tired, not into it, decreased libido. Of course, neither is right or wrong. It's just a matter of having that conversation with your partner so that you're on the same page in terms of sex. Sex is safe, have fun with it. There's no way that you can hurt the baby. The only thing really is like, think about the positions. I'm sure certain ones don't feel good. Just play around with it. If you are concerned, definitely talk to your doctor about it as well. Leg cramps will start to occur here, and better hydration, but also some gentle stretching can help with that. And the next piece that you see here is Montgomery's tubercles. And so it's really quite cool because the areola develops these glands called Montgomery's tubercles, and it secretes a scented oil that attracts the baby to the nipple. And that scent is the same scent as your amniotic fluid. So as soon as the baby comes into the world, they notice a smell because they've been living in your amniotic fluid this whole time. So that draws them to the nipple ultimately to start breastfeeding. And the oil may also help prevent infection. You may also start to see the first stages of milk being produced, which is called colostrum. It is yellow in color. It's a little bit thicker. And it may start to leak. So something to just look out for. If your bras are wet, it might just be some early leakage of your colostrum. You might also start to see additional pigment changes. So we talked about the darkening of your areolas, et cetera, in the first trimester. That will continue into the second trimester. But you may also start to notice a line coming from your pelvic or your pubic bone, up pretty much to the top of your stomach, kind of right around the bottom of your chest. And so this is called the linea nigra. And what we have when not pregnant is called the linea alba. It's just through these pigment changes that this now becomes darker. Now, while some people may think like, oh, this isn't super cute or sexy, it does go away. But there's a real reason for it. If you were to place your baby on your stomach right after giving birth, they will use that line to crawl up your stomach to your breast. They can't see very far and they can't see colors, but they can see differentiation or contrast. And so that dark line, in contrast to your skin color, will basically lead them all the way up to your darkened areolas. So really quite cool. A lot of doctors don't do it. So you may not have heard about that crawl, but that is more or less what that's used for. Hemorrhoids may start to become uncomfortable for you. You may feel them in your anus or your bottom area. This isn't harmful to you or the baby, but it may be something that you want to talk to your doctor about, as it will be uncomfortable. And then our gums are inflamed from just all of the hormones basically that are happening in our pregnancy. We have excessive bleeding of gums. Those hormonal changes can go beyond just that and lead to periodontal or gum disease. So it is something that you want to see your dentist at least once during pregnancy to make sure that it doesn't progress into gum disease. Now, in terms of the second trimester doctor's appointments, there's not a lot. What you will potentially have is a 20-week ultrasound, which will make sure that the baby is progressing appropriately. That's where you can understand the sex of your baby if you don't know it already. And you continue to have your doctor's appointments as regularly scheduled. Going back, though, to that amniocentesis, which I had talked about in terms of the timeline, this is similar to that CVS, but instead of inserting a needle into the place between your placenta and your uterus, they are inserting a needle into the amniotic sac, or the sac, to pull out fluid. And from that, they can find genetic or chromosomal disorders. It is not as risky as CVS, but it does carry the risk of miscarriage in about 1 out of 200 women. So it is still very risky. And again, if the results of this test wouldn't change the ultimate outcome, it's probably not worth the risk. All right. So that is the second trimester. It's really where you're starting to feel like yourself again. You are, you have your energy back. You're not as nauseous. You just feel good. You're feeling sexy. And then we get into the third trimester. And not that the third trimester you feel any less sexy, but of course you are continuing to grow. And so by the end of it, you're just kind of done. So in the first few weeks, you'll have a glucose tolerance test where you drink a glucose heavy drink and then have your blood drawn to see if you have gestational diabetes. In around week 30, you may start to feel Braxton Hicks contractions. These are not contractions that ultimately move you towards labor. They are contractions that we call practice contractions. So if you feel like a contraction on one side, that's usually Braxton Hicks, excuse me. If it's kind of on your sides, those are more Braxton Hicks. When we get into labor, really it's like pushing down from the top of your uterus, and those will ultimately take you to labor. Around the 36-week mark, you might have your final ultrasound just to make sure that everything's okay. It'll check your placental function, fetal growth, heart rate, general well-being. And then we get to kind of the end. So as I mentioned, 37 weeks is considered term. 40 weeks is full term. Not every doctor will let a woman go to the full 40 weeks and after. So just something to keep in mind. With regards to some of the changes that you might notice, that sleep or fatigue comes back. A lot of it is related to sleep disturbances. You have to get up more often to go to the bathroom. And sorry, if you don't mind muting yourself, I'm just hearing some noise. I don't know if I can mute you here. Okay, thank you. All right. You're getting up more often to go to the bathroom. All throughout your pregnancy, and you may have seen this already, you have very vivid dreams, and sometimes they may wake you up. Sometimes it's hard to fall back to sleep because your mind is racing. Anyways, with the third trimester, fatigue usually returns. Same with frequent urination. This time, though, it's not related to HCG, that hormone from the first trimester. This is more so the baby's head is pressing on my bladder and I need to go to the bathroom. The shortness of breath returns because, as you'll see in a few slides, basically you have no room for your diaphragm or your lungs because the baby is taking over all of your torso. Those Braxton Hicks contractions come, as we had talked about, and then a quote unquote waddle may appear. And so a lot of people are very conscious about waddling. They think that it's due to excessive weight. That's actually not what's causing this. If you think about your pelvis, your hips, your femur, the large bone in your quads, connect into your pelvis in a certain angle. And as your pelvis moves and grows and adjusts, that angle also shifts. And so the way that your femurs are connecting into your hip bones or your pelvis is now at a different angle, and that's causing the waddle. So don't be self-conscious about it. Know that it's just, a change in my pelvis, maybe not structure, but the way that it's facing. And so my bones are now at a different angle. Sorry, I see that I put shortness of breath here twice. That heartburn also comes back. A lot of it is no longer related to the fact that our esophagus doesn't contract as much, but to the fact that the baby is, again, taking up most of our torso, placing pressure on our intestines and pushing some of that stomach acid back up towards our esophagus. Varicose veins may either show or be more prominent if you already have them. If they are red or warm to the touch, something you will want to talk to your doctor about. It could be a blood clot or some other more risky symptoms. And so you want to be very open and honest with everything that's happening in your body, as well as just those varicose veins. Edema is swelling. So as we saw in the first and the second trimester, we have a lot more blood, we have a lot more fluid in our body, and it tends to stay within the extremities, our hands, our ankles, our wrists, and will cause them to swell. It may cause something like carpal tunnel or just discomfort. You can elevate them so that the fluid comes back towards the middle of your body. You can massage them and elevate your legs, etc. And then the last thing here is pelvic pressure. So as you can imagine, there's a lot of weight pressing down on our pelvis. And so that can feel like a lot of weight is being pressed on our pelvic floor. You may also feel lightening. And so this might happen more as the baby drops. It can be shooting pain in your pelvic area, almost like a little zing. It could occur when you shift or when you feel the baby move or shift. It can come and go. But if you have those kind of like spurts of discomfort, just know that it's potentially what we call lightening. Now we have an increase in tests and potential doctor visits in the third trimester. The second trimester was kind of quiet, but as we come into the third trimester, they're going to, again, test your blood for anemia, make sure that your iron levels are okay. We talked about that glucose test. They may refer to it as the 1 hour or the 3 hour. That's where they make you drink that heavily concentrated sugary drink. And then they'll test your blood 1 hour after. If you fail that, they'll make you do the 3 hour and see if you have gestational diabetes. And so if you have gestational diabetes, they'll monitor you a little bit more closely. There are some risks of a larger baby and some other risks that are associated with that. So they want to make sure that if you have it, that you're monitoring it or you're controlling it with diet and exercise. Your prenatal visits will become more frequent, really coming to a weekly visit towards the end. They'll do a group B strep test around the, I think, like 36-week mark, this is them testing or swabbing around your vagina and your anus to see if you have a certain bacteria. And if you do, they'll give you antibiotics during your labor, because they don't want you to pass those or that bacteria on to the baby. So this could be called GBS or group B strep. My doctor said there's no failing it. It's either positive or negative, and that will tell them the course of what to do next. Then we have that final ultrasound, really to check to make sure that everything's okay. And then they'll start to do internal exams. So they'll tell you how dilated or how effaced you are. I just want to say that all of these tests you can say no to. Of course, it's probably worth more research rather than just saying like, no, no, no. But if you want to minimize risk of infection, maybe saying no to internal exams, all of that's fine. Just know your rights, so more or less, as you go into these, so that you can feel prepared around what's going to happen and what you can do about it. The other thing that I didn't put up here is that they will probably also have you do a Tdap shot. And so this is for pertussis and whooping cough. And in you getting this shot, it passes that on to the baby. They'll probably tell you that anyone who's going to be in close proximity to the baby for large amounts of time, so like grandparents or anyone that may be watching your children, they should also have the Tdap shot. Again, you can say no, but that is something that they will bring up, that vaccine. And then the last piece here is that if you do have gestational diabetes, around the last month or so, they may start to hook you up to a machine and do what they call a non-stress test. And that will just monitor your baby's heart rate and movement over 20 minutes or so. They just want to make sure that they are not under any stress. If they are, then they'll talk about, moving you to induction, etc. All right. Around the 37-week mark too, they will also see if your baby is face down, if it's feet down, so like their little feet are in your pelvis, more or less. They'll talk to you about the fact that it is breech, and either you can work over the next few weeks to turn your baby around so that it's head down, or if it is breech, a lot of doctors will not deliver them vaginally that way, and they'll talk about a C-section. So all of that is the 3 trimesters, really what you can expect in your body, how it's going to change, what's going to happen in terms of the milestones and the doctor visits. Now, I want to talk about a few other things that will happen to your body. I know some of these pictures are not super clear, and I'm sorry about that. But the first picture is really what you've probably seen before. The baby, with them almost being term, is pressing up against all of your organs, really compressing your diaphragm and your stomach, etc. In the second picture, what I really want you to focus on is like that covering of the baby. So don't worry about any of the words. But the covering of the baby is 3 different ligaments. So we have one ligament called the broad ligament, which basically envelops the baby. So it's kind of like a bag around the baby. And connecting from the broad ligament to your sacrum is the utosacral ligament. And then you see a ligament that's kind of coming from the middle of that sac all the way down. It's actually going through your pelvis and connects to your vulva or your labia majora. Now, these ligaments are very important to understand because they are not like other ligaments in your body in that they only stretch to a certain amount, and they don't necessarily contract past that. These act more like muscle. So if they are contracted for long periods of time, think about that round ligament, that one connecting from the middle of the sac down through your pelvis. If that's contracted from sitting for 30 minutes, an hour, or something at a time, when you go to stand up, you may have shooting pain because that ligament is now tight and you're trying to lengthen it really quickly. So if you have felt that, just know that it's related to this round ligament, and it's referred to as round ligament pain. And so it will go through some movement in just a bit to talk about how to slowly stretch that back out so that you're moving from that contracted state to more lengthened. Similar with that uterosacral ligament, if you are laying for long periods of time, this can become contracted or tight. So as you go to get up, this then in that quick lengthening could cause pain. Now you have a round ligament on each side, and I like to think about this kind of like a hot air balloon. So your pelvis is the basket of a hot air balloon, and your round ligaments are what's tying it to the ground. If one side is really tight towards the ground, then the other side is going to be a little imbalanced and lengthened. If you are holding one of your children on one of your hips, the same thing is happening. You're always contracting one side and lengthening the other. So this now, because it's connected to your pelvis, is going to take the pelvic bones and make those imbalanced. So that can cause pain in the front with pubic symphysis, or pain in the back in terms of your SI joints. So just think about that. If you are always doing one motion on one side, try to balance it out so that you don't have this imbalanced contracted ligament and lengthened ligament causing the pelvis to be out of whack. Now, while this will cause a lot of discomfort for mama, it can also make it harder for the baby to come out because you have kind of shifted your pelvis out of balance, and now the birth canal is not straight. It is a little out of whack. The other piece that plays a big role in your pelvis being out of whack is a hormone called relaxin. And relaxin actually is throughout your whole body, and it will soften ligaments and cartilage in your body. And while this is really great for our pelvis as we move into labor, it's not necessarily great for all of our other joints, et cetera, to be a little bit more loosey-goosey. So in being a yoga teacher, one of the things that I will tell students is that if you couldn't stretch as far, or if you're finding that you can stretch farther now than you could before pregnancy, that's because you have this relaxin in your body, and only take it to the point where you could go pre-pregnancy. We don't want to stretch any of these ligaments further than they go normally because they won't contract back. So anyways, with all that being said, we do have that relaxin in our pelvis. And so it's gliding a little bit easier than maybe it had before. And so any of these external factors like your round ligaments being shorter or longer will really pull it out of alignment. Okay. Now, also connected to the pelvis is your pelvic floor. And so I know this is a little bit blurry too, and sorry, really what I want you to see is all of these muscles making up your pelvic floor, not necessarily being able to read what the different pieces of your pelvic floor are. But as you can see on the left-hand side, that there are a lot of reasons why we want a healthy pelvic floor. It is going to provide closure for our urethra and our anus. That's the sphinctering. If these muscles are weak, we can have that incontinence of either urine or fecal matter. It's very important for sexual reasons. It relaxes for penetration and contracts for orgasm. It supports all of our tissue within the bladder, the uterus, the rectum. It is like that basket holding our baby and our organs up. Otherwise, they would just fall right through our pelvis. Provides stability by providing muscular stabilization, of the pelvic bones during movement. And then it acts as a sump pump, helping the circulatory system pump fluid up from the legs. So we want to make sure that this is strong but balanced. So you may hear about Kegel exercises, and those are important. We'll go through a type of breathing exercise in just a little bit that will not only contract or try to make our pelvic floor strong, but it will also work to expand it so that it is balanced. Just as much as we don't want a weak pelvic floor, we do not want an overly strong or tight pelvic floor, because that could cause some issues as well. And we also do not want an imbalanced pelvic floor, one side being stronger than the other. That will pull those bones out of alignment as well. You may also hear that women with tighter pelvic floors have a longer period of pushing in labor. So all of that's to say we want it to be balanced. I'm going to provide you with a resource at the end in addition to the breath work, so that you can make sure that your pelvic floor is in optimal condition, both in pregnancy and then as you think about afterwards, because we want to make sure that all of these functions come back to how they function pre-pregnancy. And then the last piece really that I wanted to touch on is diastasis. And again, sorry that these images are not extremely clear when I blow them up. But if you think about your stomach, your quote unquote six pack before you got pregnant, it is like the first image. As we grow a baby and our stomach expands, our stomach muscles grow apart. So that linea alba in the middle is going to more or less separate the right abdominals from the left abdominals. And it could separate in the middle, kind of as we see in that open diastasis, kind of from the top of your sternum to your pelvic bone. It could just happen below the navel, at the navel, or above the navel. So again, everyone, it's said that everyone has a diastasis at some in some form or fashion after pregnancy. It's just a matter of where, how deep, what are the muscles like underneath? Are they really squishy, or do they have some bounce back? And if they do, how do we work to bring those back together? So again, through the breath work that we'll talk about in just a little bit, we'll talk about really re-strengthening our core post-baby to heal this diastasis. But really, we want to do that not only because maybe we don't like the look of our separated abs, or we have a hernia because of it. Some of our organs are poking through, like the weaker areas. But it can lead to back pain, poor posture, pelvic floor problems, gastrointestinal problems, constipation, and bloating. So really important that we work to fix that afterwards. Nothing to really try to fix during pregnancy outside of the breath work that I will teach you. There are a few more things that I thought about while talking. And the first thing has to do with diastasis and posture. So if you think about your posture, a lot of the weight is being pulled forward in your pregnancy as your weight distribution changes. We want to consider strengthening our back muscles, the back muscles that run on either side of our spine, called the multifidus muscles. We want to work to strengthen that so that they can pull or hold that weight back. If you have weak multifidus muscles, then basically they're going to let that weight just fall forward, which will increase the diastasis. So something to think about. You may also want to bind, whether that is with like a bind, like a Velcro bind that you buy, or you can use kinesiology tape basically to hold your stomach back so that all that weight isn't just pushing on the already weakened midline of your abs. Now, as we think about the back, there's one other thing that around week 20, you may hear. Your doctors or others may tell you, you cannot lay on your back. And while there is some truth to that, really your body is amazing at knowing when something's not right. And it will tell you in the form of pain or some other indicator that something's not right. And so what is really happening is that you have a major vein running on the right side of your spine that's carrying all of that blood throughout your body. Now, if that's compressed because the weight of the baby when you lay down is compressing that, then that could cause lightheadedness or issues with oxygen getting to the baby. Again, this is where your body is going to say, whoa, I'm feeling lightheaded. And you can think, okay, it's probably because I'm on my back. The other thing is if you lay on your right side, you're going to compress that vein a little bit more than if you lay on your left side. So most people will tell you to lay on your left side rather than your back or your right side. And that's because of that vena cava that runs along the right side of your spine. But again, I've heard from many women that are like, I woke up and I was on my back, and like, how bad is that? And it's really like your body would wake you up or would tell you to move before you do like any real major damage. So just something to keep in mind. Okay, now I talked about a few resources, especially as we think about the pelvic floor and diastasis. One of my favorite resources is in the upper right-hand corner here, the pelvic PT. Here she's doing an external exam. They also do internal exams to see how balanced and how strong your pelvic floor is. And we'll give you some exercises or some physical therapy activities to do after the fact to strengthen it, to make it more balanced, whatever it may be. A lot of discomforts may be due to misalignments. We kind of talked about all that in the pelvis. And a chiropractor is really good, especially in conjunction with a pelvic PT, to make sure that your spine is in alignment, your SI joints and your hips are in alignment, and that can reduce a lot of discomforts as well. As we talk about like the swelling and just the excess fluid, the way that we're carrying weight, massages are amazing. You will definitely want to make sure that they know that you need a prenatal massage. Not everyone's comfortable doing prenatal massages, and do take some time for yourself and some self-care during this time of growing a baby. You definitely have earned it. And then, of course, your diet and your nutrition is very important in your whole pregnancy. And so that's out of scope of my practice to recommend anything, but I do have a lot of great referrals that can help you understand maybe what supplements you should be taking, where you can get certain nutrients. For example, you may have read that you need so much calcium every day for strong bone development in your baby. Well, a lot of us don't drink cow's milk, or maybe we can't drink the amount of milk that we need to. A dietitian, nutritionist can go through and tell you all the other foods that contain high levels of calcium to implement or to integrate into your diet, and just make sure that you're making the best choices for not only you, but your growing baby and all the needs that it has over the course of its development. I have amazing local resources that I can provide to you if you need for any of these areas. There are other individuals that I just didn't list here. This is more so like for feeling good through your pregnancy. This is who I would recommend. Of course, there are others beyond this that are really great in supporting you throughout your pregnancy, whether it be a mental health specialist, a doula, etc. I have resources for all of those as well. So please don't hesitate to ask. Now, the other large piece of a healthy pregnancy is movement. And so a lot of times, if you're active before pregnancy and you want to continue that activity in pregnancy, more than likely you can talk to your doctor. It's definitely not a time to start any new fitness regimen or programs, but definitely you can continue what you were doing. I am a prenatal yoga teacher, and so these are the classes that I teach in the St. Charles, Geneva, Bartlett, and Barrington area every week. If you're interested, you can use that QR code to go to my website and sign up. Prenatal yoga is just amazing in terms of helping you alleviate some common discomforts while we talk about like the various asanas or poses of yoga, and we'll move through some of those. We'll do some in just a few minutes here. We also work on preparing your body for birth, preparing your mind for birth with meditation, and then that breath work that I talked about for balancing and strengthening your pelvic floor and working on the strength of your abdominal muscles to prevent a really large diastasis at the end of your pregnancy. As I mentioned at the beginning, this is only one webinar in the course of a whole year's series. We started with fertility in January. In March, we have Dr. Hansen from Hansen Family Chiropractic coming, talking about postural issues, discomforts that are associated with that. We talked about some at a high level tonight, but we'll definitely get into more within that webinar. And then in April, we have Lara from Holistic Family Doulas coming to talk about the stages of labor. So what you can expect as you start to go into labor, ultimately all the way through birth. In May, we have a prenatal and postpartum mental health. It's Mental Health Awareness Month. And so we have someone from Graceful Therapy coming to speak to just your mental health during that pregnancy period and after. So again, that QR code will take you to my schedule. You can sign up for any of those webinars. They are free, and I hope you will join me for that. I did not put a link to my YouTube channel, but if you look for Empowered Mama Fitness on YouTube, the webinar from January, as well as the webinar from tonight, will be on there, so you can watch it or share it with any friends that you think would be interested. With that, are there any questions? Okay. Well, if not, I am going to stop sharing my screen, and I am going to move to my yoga area. We'll do a little bit of movement to help alleviate some of the common discomforts. We talked about those ligament pain, back pain. We'll work on some breath work and just a short meditation and positive affirmation. So hopefully you can stay around for that. If not, I want to thank you so much for joining me. I hope this has been informational. I'm happy to share the slide deck if you would like. But really, that is what you can expect kind of happening in and to your body over the next or over the course of 40 weeks. Hopefully, if you've seen things happening in your body and you wondered why, this answers some of those questions. If you want to take just a minute to kind of get down to the floor, onto your hands and knees. And so I talked about that ligament pain before. And so sometimes when you're like from a seated position and you get up really quick, that's when you're going to get the pain. And so what we want to do is just move through some gentle cat and cows, basically to start lengthening those ligaments in a more controlled manner. So as you inhale, look up, really starburst your chest through your arms, As you exhale, push your shoulders away from the mat, tuck your chin to your chest, and round your tailbone. Work through a few of these at your own pace. And when you're ready, join me back in tabletop. Now, another great way to lengthen those ligaments rather than just quickly lengthening them is to do a wag the dog. So we turn and look over our left shoulder towards our left hip as we kind of wag our left hip towards the side. And then we do the same on the right side. And wag and wag. All right. Join me back in tabletop. And on your next exhale, send your left leg behind you, digging your left toes into your mat. And on your exhale, push your torso, your body weight back so that you feel a really nice stretch in your calf muscle. On your inhale, go ahead and release that stretch, and exhale, push back. This is nice for those leg cramps that you may be experiencing. If you have kind of Jimmy legs or, jittery legs at night, this is a nice way to kind of stretch out your legs. Now come back to a more neutral tabletop. And if it feels good on your next exhale, lift your left leg off the mat. Even if it's just a few centimeters, lift it off the mat. Work to keep your hips parallel to the ground so that you're not hiking one hip up. If you have pubic symphysis pain, this really is because your hips are either out of alignment, up and down out of alignment, or back and forth out of alignment. And that can really hurt kind of right in the middle of that pubic bone. And this won't feel good. So if it doesn't feel good, that's your body's way of saying, don't do it. Now, if you would like for a little bit additional challenge on your next exhale, lift your right arm. So you're really reaching through your right fingertips and your left heel. Place both down on your mat. Turn your right toes out, open over your left shoulder. And reach your left arm towards the top of your mat. Really just stretching out your entire left side. On your next exhale, place your left hand down, bring your right toes back in, and your left knee under your left hip. On your next exhale, send your right leg behind you, digging your toes into your mat. And feel a nice stretch in your calf muscles. Again, coming out of it with each inhale and returning to that stretch on your exhale. On your next exhale, if it feels good, lift your right leg off the mat. Again, option for a little bit of a challenge to lift your left arm, really reaching through your left fingertips and your right heel. Place both down on your mat, turn your left toes out, open up over your right shoulder, and reach your right arm towards the top of your mat. Come back into tabletop. Bring your toes together, your knees out wide, and stretch back into child's pose. Option here to stay in child's pose or come up through tabletop. And on your exhale, push back into downward dog. This is another great way for you to stretch out your calf muscles, but it also really helps pull all that weight off of your pelvic floor, stretching those ligaments in the front, pulling on that uterosacral ligament in the back, kind of letting gravity do some of that lengthening of those ligaments. And then walk your hands to your feet and let yourself just hang here in a forward fold, taking all of that weight off of your back. This is a great one to alleviate any back pain. Slowly roll up, vertebrae by vertebrae. Inhale up and exhale down. Slowly come back down onto your mat. Now, that is a yoga sequence that you can do at any time during the day. It's fast, so hopefully that works into your schedule. But I want you to come back to your mat, or back to a gentle seated position, and we'll work on that breath work. And so if you've ever done a Kegel, basically it's you like lifting your pelvic floor as though you're stopping the flow of urine. And that's great. But what we want to do is incorporate all of our core, starting from our diaphragm, incorporating our stomach muscles and our pelvic floor in this exercise. So on your next inhale, really feel your lungs expand, your ribs, feel your stomach expand, and feel that air almost as though it's pushing out the bottom of your pelvis. Here, we're lengthening the muscles of the pelvis so that we're creating that balance, not just strength. On your exhale, imagine the four bony parts of your pelvis coming together at the bottom, and then lift your pelvic floor as though stopping the flow of urine. On that same exhale, feel your abdominal muscles corset your baby, almost as though you're hugging your baby with your muscles, and your rib cage fall back into place. So let's do that a few more times. Expand your rib cage, your stomach, feel that air come out the bottom of your pelvis. On your exhale, close the four bony parts of your pelvis, lift your pelvic floor as though you're stopping the flow of urine. Corset your baby with your abdominal muscles, giving your baby a big hug with those muscles, and let your rib cage fall. Do that a few times at your own pace and your own breath. First, feeling the expansion, and then the contraction. Now I use this full breath. It's connected breath or diaphragmatic breathing, if you wanted to look it up, really because your core runs from your diaphragm all the way to your pelvic floor. And the pressure that your breath puts on the various parts of your core can lead to a bigger diastasis, pelvic floor dysfunction, etc. So that's why we want all these pieces of our core to work together in this breath. Just do a few more at your own pace. All right. Place one hand on your heart, one hand on your stomach, and return your breath to a natural cadence. So feeling the rise in your chest, the expansion in your stomach on your inhale, let it all fall with your exhale. Spending this time really connecting with your little one, sending loving, positive thoughts on your inhale. And if you have anything that's been nagging at you, just let it go with the exhale. Inhale those loving thoughts. Again, exhaling self-doubt. Just keep with this cadence here. Big inhale, expanding your rib cage, your stomach, feeling the rise of your chest, letting it all fall with the exhale. Really maintaining that positive influx of emotions on your inhale and releasing everything with your exhale. So that at the end, only the positive remains. Now you share a lot with your baby, whether you realize it or not. And when you relax, your baby relaxes with you. So as you go throughout the day and you feel overwhelmed or stressed, return to this breath as often as you need, even if it's just a few breaths in one sitting, just to really engage your parasympathetic nervous system and relax your body and your baby. Continue with this just a few minutes. Again, this breath is a very powerful tool that you can use not only to calm yourself, but your growing baby. At the end of every yoga practice, I talk about a positive affirmation. And if you don't have one for your own pregnancy and your birth, I would highly recommend you look into one that really resonates with you. But with everything that we talked about tonight, there's a lot of changes that are going on in our body. And so the positive affirmation that I'll leave you with tonight is I love and accept my changing body. You may not always understand why things look the way they do, feel the way they do. Hopefully we cleared up some of that tonight. Just tell yourself, I love and accept my changing body. You're doing an amazing thing. You are growing a little human. That takes a lot of work. And as we said at the beginning, creating life is a miracle in and of itself. Be proud of yourself, all that you're doing to sustain life. And find that love and acceptance in your own body. Let's take 3 deep breaths here to finish our practice tonight. On your inhale, bring your arms up overhead, palms to touch at the top. Exhale, both palms down to heart center. Inhale, palms up. Arms up, palms touch at the top. And exhale, palms down to heart center. Last time, biggest inhale of the night, bringing in all of those loving, kind words for yourself and for your baby. And exhale out your mouth, anything negative that you're holding on to. Again, leaving only positivity and love for yourself, your changing body, and your baby. Bring your chin to your chest. And one last time, we'll say that affirmation to ourselves. I love and accept my changing body. The light in me honors and respects the light and the little light inside of each one of you. Namaste. Thank you so much for joining tonight. I hope you got a lot out of it. And hopefully I will see you in class soon or at an upcoming webinar. Have a great night. Take care.